The Health Ministry is attempting to reduce the number of cervical diseases and issues among the population. The ministry, through the Universal Health Coverage Program, unveiled a new procedure for conducting pap smears and HPV tests free of charge to residents to be rolled out next month. The goal is to decrease the number of cervical deaths by 30% in the next 6 years.
First target, 90% of the girls by age 15 are fully vaccinated against the human papillomavirus or HPV that causes cervical cancer. The second target, 70% of women are screened with high performance tests by age 35 and again by age 45. And the last target, 90% of women identified with precancerous lesions or cervical disease receive treatment including palliative care. St. Lucia, like many of the other countries, need to reduce by 30% the number of cervical cancer deaths by 2013, and that is a Sustainable Development Goal 3, Target 3.4.
There is no cure for HPV, and HPV testing is recommended as the primary test for cervical cancer. Director of the UHC, Dr. Alicia Eugene Ford, expounded on the benefits of the new method.
We will be using the new method of conducting pap smears at the primary healthcare facilities. This new technique, or liquid-based cytology, which we plan to launch in August, allows testing for HPV, particularly high-risk strains such as strain 16 and the strain 18, which are responsible for most of the HPV-related cancers. STIs such as gonorrhea and chlamydia from a single collection can be done as well. Theoretically, the liquid-based cytology technique has the advantage of easier interpretation, fewer unsatisfactory results, the filtering of blood and debris, and lower frequency of conducting pap smears. In the last century, cytology-based cervical cancer screening has been crucial in reducing the incidence and mortality of cervical cancer.
In 2019, the Health Ministry commenced vaccinating students in grade 6 against the HPV virus. Both boys and girls are being targeted.
We know the focus is on girls as we talk about cervical cancer. However, we know that there are other HPV-related cancers that also can affect boys and men. Hence the reason why we decided as a country to introduce the quadrivalent vaccine to both boys and girls. As of 2023, our coverage for that vaccine was 82%. So as you see, we are not very far from our 90%. However, we still need we still have a lot of work to do.
It is hoped that the new liquid-based cytology procedure for pap smear and HPV will help in detecting and preventing death or long-term complications of cervical cancers. Gina Filippi, HCS News Force.